This is a very interesting case. This child presented to us with a history of swelling and lump on the back as seen here. So any condition in which there is a lump on the back and we are suspecting it to be involving the vertebral column, where the vertebral column is affected, uh, we call it spina bifida, and further categorize these spina bifida into spina bifida occulta and aperta. If the overlying skin is grossly normal, as seen in this index case, we label it as spina bifida occulta. So it is basically case of spina bifida occulta. The child had this lump alongside the other findings in the form of weakness in the lower limbs, and also child has pathologies involving the bladder and bowel. Patient had continuous dribbling of the urine as well as the constipation. So the next important step in managing this child is to go for the imaging of spine in the form of MRE spine and look for underlying pathology. So this is the MRE of this index case. While describing this MRE, you will describe it as that is it is the MRE of spine, and it is taken in the axial sections. Normally, most of the MRI will be visualized in the sagittal planes, but this MRE is visualized in the axial section. By visualizing this in axial section, I am going to tell you a very important finding that is shown here. So if you zoom it and to zoom to a single image, the finding will be visualized here. So if let's see this finding, this one is this part. This is basically the axial section of the spinal cord. These are the paraspinal muscles, and this is the skin overlying the spine. An important finding is seen here in this area. So this is basically the vertebra and body of vertebra. From the body of vertebra, a bony spur is seen here, and two hypodensities are seen alongside it. So this is basically a case of Diastematomyelia Type 1, where the bony spur arises from the vertebral body and then divides the spinal cord into two halves. So this is case of basically diastematomyelia, and it is type 1 diastematomyelia where the spinal cord is divided into the two halves by a bony spur that is seen here. Thank you.